Becca, and today I'm going to be covering meningococcal meningitis, a disease that most often times infects the brain and spinal cord. So the topics that I will be covering today for this disease are the causative agents and the types of infections, the risk factors for this disease, signs and symptoms, diagnosis, treatment, prevention, and vaccination. The cause of meningococcal meningitis is a bacteria called Neisseria meningitis. This oftentimes infects the brain and spinal cord. However, it can cause infection in the blood. When it does infect the brain and spinal cord, it causes swelling of the meninges around the brain and spinal cord. And this is why you usually get those symptoms of headache and neck stiffness. 1 in 10 people that walk around us every day have this bacteria living in the back of their nasopharynx, but they are not sick. However, infection does occur once this bacteria moves. As you can see, the bacteria here are the cocci shape and they're clustered together. So the most common risk factors that we see according to the CDC are the very young and the very old. However, many times you will see a large concern amongst teens and young adults. So children that are younger than a year old are at a higher risk. Teens and young adults, ages 16 to 23. This group covers a lot of high school students that are in sports, or college, even to college students or new military recruits that are within close living contact of each other. Adults 65 years and older due to a suppressed immune system, certain medical conditions, and certain medications. Often the medications that might put you at an increased risk for meningococcal meningitis are going to be medications that help treat the medical conditions that also put you at a risk for meningococcal meningitis. Close or lengthy contact with somebody who is infected, or places and settings where people work, live, and travel. So your risk factors such as medical conditions. Conditions such as anatomic or functional asplenia. So functional asplenia is going to be your diseases such as sickle cell disease, or anatomic, where that spleen has been removed. So this does suppress the immune system. HIV is also another risk factor, as well as complement disorders such as generalized myasthenia gravis. Lengthy or close contact with someone who has been infected or who is infected. Anyone with direct contact with an infected individual's oral secretions, such as kissing or sharing drinks or sharing eating utensils that haven't been washed, are also at an increased risk for meningococcal meningitis. Also living in the same household as somebody who is infected with this disease. So roommates, family members, whoever you might live with, if they become infected with this disease, you are also at an increased risk. Places and settings where people work, live, and travel. So microbiologists who work directly with the disease-causing bacteria for meningococcal meningitis are at a higher risk of contracting the disease. College students, because they live in close quarters. Military recruits for the same reason, especially the new ones when everyone's all clustered together. And travelers to the sub-Saharan Africa. So this is also referred to as the meningitis belt according to the CDC. Signs and symptoms of meningitis include most commonly headache and stiff neck and light sensitivity, also known as photophobia. However, fever, nausea, and vomiting are also common. If this disease does become bad enough, someone can become septic from infection. Long-term side effects. 1 in 5 people will develop long-term effects from meningococcal meningitis infection. These can include brain damage, deafness, loss of limb or multiple limbs, and problems with the nervous system. Diagnosis for meningococcal meningitis can be very difficult. The symptoms that present with meningococcal meningitis can be the same as the common cold or the flu or migraines when they first start presenting. However, as they progress, signs and symptoms of sepsis, or the patient may become confused, all of those can develop. So, when this disease is suspected, a lumbar puncture is the most common way to diagnose this disease. So, here, as you can see on the screen, this little needle is inserted into the spine right before the spinal cord here. And here you can see what looks like little water dripping out of the catheter. This is because the CSF that is within this little space right here drips out of this little catheter and is collected for a sample. Oftentimes this is cultured to see if the CSF has that bacteria growing within it and is causing that meningococcal meningitis. Blood cultures are also drawn kind of for the same reason, to determine whether that is the infection, especially if it has moved into the blood. Um, this also aids in determining which antibiotic would be the best to treat this disease. Culturing the lumbar puncture fluid would also help with that. However, blood cultures will also oftentimes be drawn just to help determine if that infection has moved elsewhere. Treatments for meningitis, the most common is antibiotics. Usually it's going to be an extended spectrum cephalosporin such as ceftriaxone or cefotaxime. On occasion, penicillin G or ampicillin may be used. However, susceptibility testing is needed because those two antibiotics do not always work for meningococcal meningitis. Occasionally, the bacteria will need to be eradicated from the nasopharynx. If this is the case, additional treatment may be needed from antibiotics. So usually this is going to be used by a single dose of ceftriaxone or ciprofloxacin, most commonly known as Cipro. But if those are ineffective, rifampin may be administered in 4 doses over 2 days. Other treatments depends on the severity of the disease. Here you see a nurse operating, or some sort of healthcare professional operating a ventilator. So respiratory support may be required if the disease progresses to the point that an individual can no longer maintain their own breathing. So a tube may be put down their throat so that they can start having this machine breathe for them while their body is trying to recuperate from the infection and antibiotics are being given. Also, if sepsis develops and hypotension does occur, these medications here, such as Levophed, also called norepinephrine, dopamine or dobutamine, may be used to help raise that blood pressure. Wound care for areas that with damaged skin. So if that person has been laying down in a bed for a long time and develops sores or any other infection that may be arising from sores of any kind, wound care may be needed. And even with these proper treatments, 10 to 15 out of 100 people will still die from meningococcal meningitis. Vaccination, according to the CDC, is the most effective measure for prevention of meningococcal meningitis. In the US, we have 5 different meningococcal meningitis vaccines. So we have Menveo and Medquadvi, Bexsero and Trumemba, and the MenABCWY vaccine. So the MenACWY, also known as Menveo or Menquadvi, it protects against 4 different serogroups, so the A, C, W, and Y. It is also known as a quadrivalent meningococcal. Men-B, also known as Bexsero or Trumemba, this is the one that is most commonly given to your preteens, adolescent, and young adult patients who are at a little bit more of an increased risk. It protects against the serogroup B for meningococcal meningitis. The number of shots that a person will need to receive depends on the severity. So individuals that are age 16 to 23 that are not at an increased risk only get 2 shots. However, if they are 10 years or older, they are, or at an increased risk, they will get 3, according to the CDC. The MenABCWY vaccine provides a similar level of protection and pattern of protection as the other 2 types of vaccines, but this would provide more protection in one injection. Other preventative measures, as far as prevention goes, vaccine is the biggest method of prevention. However, if you do come into close contact with somebody that is infected with meningococcal meningitis, providers will oftentimes provide prophylactic antibiotics. So medications such as ciprofloxacin or Cipro, rifampin, and ceftriaxone, just so that the disease does not move further into a severe infection. Reinfection is often rare. However, it does happen, and if it does happen, then that individual should be tested for an underlying immune deficiency if they do not know of one that they have. So, if they believe that they are perfectly healthy and that they have no autoimmune disorders or immune deficiencies, they need to be tested, because oftentimes people with healthy immune systems do not become reinfected with meningococcal meningitis. So to close, we covered today what causes meningococcal meningitis and a little bit about the disease, as well as symptoms and complications. Vaccination for prevention of meningococcal meningitis, as well as how we diagnose the disease, and prophylactic measures taken in case you come into contact with meningococcal meningitis. Here are the sources. The information provided on the slides today came from the CDC, all cited here. These sources down here were used for the pictures that were on the slides today.